Hi, we're today going to look at the second part of the bone tissue lectures, and we'll be looking at how bones are classified today and bone markings. Bones are classified by their shape, so we're going to take a look at shape classifications. Also, another way to classify bones or something to consider is how they formed. So their embryonic development puts them into different categories. Also, their how much spongy bone they have versus the compact bone that we looked at in the first mini lecture. So we have some major shape classifications here that we're going to explore. We have kind of your typical long bone that we'll look at. We have our flat bones. We have a group of bones called sutural bones, or sometimes they're also called Wormian bones that we find in the skull. We have a group of bones that we call irregular bones, the ones that don't kind of fit in any of these other categories, the potpourri. We have short bones, and then we have the sesamoid bones. So we'll take a look at each of those groups. We're going to first look at the long bones because these bones are kind of, I guess, if you had someone draw a bone, for example, right? This is the stereotypical bone that they would draw. A lot of bones are they're not necessarily always long, but they are always longer than they are wide. Their structure consists of some basic parts. So long bones have epiphyses. Epiphyses are basically like the ends of the bones. So there's two epiphyses. The one that is closer to the point of attachment is called the proximal epiphysis. So this one is going to be proximal. And hopefully you recognize this bone, right? In the upper arm here, we're looking at the humerus as an example. And the opposite of proximal was distal. So this is the distal epiphyses. Ooh, move you over there. So distal and proximal epiphyses, these are the ends of the bones, and when you slice them open, you can see that the epiphyses has a lot of spongy bone in it, right? Long bones have compact bone too. You can see compact bone on both sides of the medullary cavity here. The kind of neck area of the bone here, where it begins to narrow, is called the metaphyses. The meta means middle, and then the diaphyses is the shaft. So that's going to be the long, skinny part of the bone here, and that has the medullary cavity, which you can see here in an adult, contains that yellow marrow. And what was the yellow marrow important for storing? Fat. In young children and infants, this is red marrow for hematopoiesis, but as we age, it gets replaced with that yellow marrow. As adults, we still have red marrow up here in the spongy bone. That's where you'd actually find that red marrow, remember, within the trabeculae of that spongy bone. Long bones are covered with two linings, one on the inside, one on the outside, right? So endo means within. So the endosteum is basically going to be the tissue that surrounds the inside of the bone. It's going to surround the inside of the medullary cavity here. It also is going to line the spongy bone. A little harder to draw that in. And then the periosteum is the covering that's on the outside of the bone. So when you actually touch the surface of the bone, that's the periosteum. We've talked about the medullary cavity already, right? That it's surrounded by compact bone. It's where that yellow marrow is. Examples of long bones. So in addition to the humerus here that we're seeing in this picture, the other bones that make up the rest of the arm, the radius, the ulna, the femur, in the lower leg, the tibia and the fibula. Also, the bones that make up our digits, our fingers. The phalange bones are long bones, as are the ones down here in the feet. So those are all long bones. Our next shape of bone is the opposite of long. This is going to be our short bones, and these bones are small, kind of cube-like. They're going to be about as tall as they are wide. They have a spongy core. So if you were to slice one open, and maybe in lab we will see some sliced open bones, or at least some pictures of them. If you were to do a cross section through a spongy bone, you'd see, or a short bone, you see it's mainly spongy bone. So it has a lot of spongy bone with kind of a compact cover, but it's mainly spongy bone. And examples of spongy bones, here's one right here. This is a bone that we find in our ankles. It's one of our tarsal bones. This is the talus, but all of the bones that make up our ankles, so all of our tarsals and the bones that make up our wrists, our carpals, are also going to be all classified as short bones. Our next grouping of bones is going to be the flat bones. Find a good place to try it up there. Our flat bones, we saw a diagram of earlier. These are the ones that have that dipole. They have compact bone and then spongy bone in the middle, and then compact, right, like a sandwich. So they're typically thin, flat, have a little bit of curve to them. They protect areas like our sternum and our skull are both flat bones that protect. They also provide sites for muscles to attach to. So they have a compact, spongy, compact structure. They're typically thin and curved and flat. So examples, most of the bones of the skull, there are some exceptions to that. You can see one example up here. You recognize that as the sternum. Our ribs are also flat bones. The scapula are flat bones. Our next type of bone, just can't seem to find a good place to stick me, are the irregular bones. So these are the bones that don't kind of fit those, any of the other classifications. So you can see one example of an irregular bone here, right? This is one of our vertebrae, and it's down here in our lower back. So this is actually a lumbar vertebrae. So the irregular bones have complex shapes to them. They have flat surfaces and notches and ridges. They typically have all those things to attach to muscles. If you cut them open, they have a combination of compact and spongy bone inside of them. So some of the other bones of our skull that we'll see are irregular bones. The vertebrae, as an example here. Also, the bones of our hip, or our coxal bones, are irregular bones. All of the vertebrae, not just the lumbar. So the cervical and thoracic are also irregular bones. Our next few categories don't include as many examples. The sesamoid bones, these are bones, like you can see here as an example. Our kneecap, our patella is a sesamoid bone. These guys, they're similar in structure to the small bones, and they kind of look like small bones, and if you cut them open, you'll see that they have a spongy core with like compact outside. But these are unique in how they develop. They develop in tendons, and some of these don't develop until after we are born, like the patella, for example. So if it develops within the tendon, it's a sesamoid bone. So they're kind of like a subcategory of sorts of the short bones. The patella is one. Some of the bones in the wrists and the ankle are also sesamoid bones, and what's interesting about these is we vary in the location and number of them. So there's over like 26 locations in the body where we can find these bones, and they do, it's an example of variety, anatomical variety between humans, but the patella is one that we all have. And then our last little category is the Wormian bones. The Wormian bones are also called sutural bones because they occur in the sutures. The sutures are the joints between the bones of the skull. So these are sutures, right? Now here is a Wormian bone, and they have names for where they occur, what suture. So the suture back here that goes across the back of the head, and it separates this bone in the back here called the occipital bone from the two parietal bones. It's called the lambdoid suture. So this particular Wormian bone here is lambdoid, but they're kind of like small flat bones that are found between, and there's variation between humans and these two. So we differ in the number of them and location of our sutural bones. So as you look at actual human skulls, you can look for sutural bones, because sometimes people will have a few, sometimes you'll have none, sometimes you'll have a lot in a skull. Okay, the last thing we're going to look at today is bone markings. So in preparation for digging into the appendicular and axial skeleton, and also thinking about how the skeleton relates to movement when we get to muscles, there are some terms that you need to know because you'll be identifying these as you look at different bones. So we have things called bone markings, and bone markings are basically surface features of the bones. They typically are attachment points for muscles, so muscles end in tendons, tendons then attach to the bones at these points, or also attachment points for ligaments. Ligaments are structures that attack bone directly to bone. For example, we have a lot of ligaments in our knee. So at sites of articulations of joints, we're going to see these attachment points. Also, some of these markings are locations where blood vessels are going to go through a bone or run alongside a bone, or nerves. Sometimes they are holes within a bone to allow like a blood vessel to directly pass through. So here we have projections are one type of bone marking. Projections are going to be things like processes, which is kind of like a bump or an enlargement on a bone. We also have a ramus. A ramus is a part of a bone that forms an angle. So for example, here you're seeing the mandibular ramus, right? And you can see it is coming up at an angle, right? You can see there's kind of an angle here, and it's coming up to make contact with another bone. Over here, this process, our cheekbone, that's our zygomatic process that we see there. And then over here, we have a bunch of different terms for openings. So for example, in some of our bones, we'll see sinus. Sinuses are our air-filled chambers within bones, and we have several sinuses located there. You can see a cross-section, a sagittal section through the skull, and you can see inside that sinus. Another name for an opening is a foramen, and so this is going to be a passageway where blood vessels or nerves run through. This particular sinus I forgot to mention, this is the frontal bone, so this is the frontal sinus. These are the foramen. This particular foramen here is this is the orbit of the eye, and it's above it, so it's the supraorbital foramen. Another name for an opening is a fissure, and so this is not going to be a round opening, but it's going to be more like a slit. So in the back of the eye orbit, you can see a fissure back there that allows for the optic nerve to leave the eye and head towards the brain. Another name for an opening is a meatus, and this is typically like a longer channel, a passageway, as opposed to just a short hole that lets something through. So I think more kind of like tunnel-like. And so here you can see a meatus. That's the internal acoustic meatus, or the hole that the ear goes through within the temporal bone. We also have canals. Canal is going to be kind of similar to a meatus. It's going to be a tube. So for example, in the eye, we have the lacrimal canal that takes tears down and drains them from the eye to the nose. A few other terms. We have depressions within bones. So sulcus is kind of a narrow groove. So for example, here there's a little sulcus or groove that's between two structures. So it's called the tubular sulcus. It's between the tubercles. There's two tubercles here, and it's between them, intertubercle sulcus. We also have fossa, which are kind of like shallow depressions. So you can see a little fossa here. This one on the anterior side here is the coronoid fossa. There's another one if you were to flip the bone over and look at the opposite side. We would see the olecranon fossa. We also have projections where muscles, tendons, and things attach. So a projection called a trochanter is basically like a big rough projection. So here you can see it on the femur. There's actually a greater trochanter and a lesser trochanter. A crest is kind of a prominent ridge across the bone. So here we can see that this is the ilia. So this is the iliac crest. A spine is a pointy process. So you can see a spine here, another spine here. This is the anterior iliac spine. And we'll get into each of these bones and the markings that you need to know when we get to the axial and appendicular skeleton. This is kind of an introduction to what these terms mean. A line is kind of like a low ridge across the bone. The tubercles, these are basically small bumps, small projections. So you can see tubercles on the bone, on the humerus here. Lesser and greater tubercles let you know something about their size. Tuberosity is basically a projection on a bone, a rough area where a muscle. So for example, this is the deltoid tuberosity because the deltoid muscle attaches there. We also have the head. A head is the name for a large epiphysis, the large end of a long bone that fits into like a ball and socket joint. The neck is the connection between the epiphysis and diaphysis, where it narrows there. A facet is kind of a flat area where there's an articulation, so you can see a facet here. Condyles are round, smooth areas on bones, typically at where a joint is going to occur. So you can see a condyle here in this area on the femur, and you can also see some condyles. There's actually a couple over here on the humerus, and same thing here. We have lateral condyles and medial condyles, or condyles can have names. We also have over here a bump called the trochlea, a kind of a groove, I should say. So the trochlea is in this area. It allows the bones that articulate with the humerus, right? They have a projection that kind of fits into the trochlea. So for now, if you're just kind of familiar with what some of these terms mean, we'll get into the specific ones that you need to know on individual bones coming up in the next modules. And that's it for today.